crook. Well, I'm not a crook.
I did not have sexual relations.
An absolutely perfect phone call.
On ABC News and ABC News Radio, welcome to Planet America's Fireside Chat. I'm John Barron.
And I'm Chaz Licciardello.
Coming up this week, one of Bernie's biggest backers, Ben Jealous, on whether Sanders can still win the presidency or indeed what Joe Biden needs to do to win over progressives. But first, an update on the COVID-19 pandemic in America. Models suggest at least 100,000 Americans will die. The daily death toll is approaching 1,000 already. 90% of Americans in at least 37 states are now being told to stay at home. And more than 6.5 million people have filed for unemployment benefits in a week. That means the unemployment rate in the United States is likely to have gone from 3.5% to over 10% in the space of a month.
Okay, well, why don't we look at the numbers as they stand internationally to begin with. In America now, they've got about 244,000 cases, more than twice as much as any other country, and with around 30,000 new cases every day. Note, by the way, that China has supposedly had only 35 new cases today. I'll be coming back to that one later. As far as deaths go, America is now at over 6,000 deaths, with about 1,000 new deaths per day, as John just said. And the government models are projecting that rate to double again in the next week or two. But there is some good news. Look at Italy there. 4,500 new cases. That sounds like a lot, but new cases in Italy have very much stabilised and are in fact on their way down, while new recoveries from COVID, that's a stat we don't talk about much, are slowly increasing. Italy was about 2 to 3 weeks ahead of America, so that is a positive sign for the future for America. But now the bad news. America doesn't have one outbreak anymore. It has at least 10. New York is obviously going wild with 93,000 cases and 9,000 more just today. If New York was a country, it would have the second most new cases in the world behind America. And it has over 2,500 deaths. But look just below New York. New Jersey has over 3,000 new cases every day and 182 more deaths a day. And it goes on. 8 states with over 1,000 new cases each every day. Each of those states are now demanding emergency resources from the government and are expected to get worse. But I've got some bad news for those states. The government's emergency stockpile of masks, gloves and medical supplies is pretty much out. So the next few weeks are going to be very tough. There is a silver lining in America as well though. Look at the last state on that list I just showed you, Washington. It has considerably fewer new cases than the other states. Washington was the state with the first outbreak in America last month, and its new cases have basically halved over the last few weeks. So it is now, I wouldn't say completely under control, but it's on the way. In Washington, the average infected person was spreading the virus to 2.7 other people earlier in March, but now they're only spreading it to 1.4 other people. So John, it can be done. In America, it can be done with the strategies they're using. They just have to hang in there for another month or so.
It is certainly going to be a very tough few weeks or indeed months. This week, the President stopped talking about reopening the United States in time for Easter after being told by his medical experts that could see up to 2.2 million American deaths. That's if there was no mitigation. President Trump then recommended that Americans should cover their faces in public to reduce the chances of catching coronavirus. And he said if you can't get any masks...
You know, you can use a scarf. A scarf is, everybody, a lot of people have scarves, and you can use a scarf. Scarf would be very good. And my feeling is if people want to do it, there's certainly no harm to it. I would say do it, but use a scarf if you want, you know, rather than going out and getting a mask or whatever.
That discussion of what to do in the event of an absence of masks came after the President had earlier said there was something a bit fishy about the increased demand for surgical masks in New York hospitals.
How do you go from 10 to 20 to 300,000, 10 to 20,000 masks to 300,000, even though this is different? Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door?
Were you suggesting there has been inappropriate use of masks or improper conduct with supplies?
No, I want the people in New York to check, Governor Cuomo, Mayor de Blasio, that when a hospital that's getting 10,000 masks goes to 300,000 masks during the same period, people should check that because there's something going on. It's not, I don't think it's hoarding. I think it's maybe worse than hoarding, but check it out.
Basically, the implication there is that hospital workers are on-selling medical equipment, such as masks, for profit. There's no evidence of that.
No, I would have thought the answer to his question about what's going on is there's a COVID problem.
Yes, they're using a lot of masks right now.
Yeah.
Now, by the way, doctors are also saying that wearing a scarf to prevent infection is unproven. They say they simply do not know at this stage. We're too early in this epidemic. They do warn it could also be counterproductive because if people put a scarf on or a bandana, they will also be touching their face if they're trying to adjust it. Most, however, do agree that there is some virtue to this, which is why the CDC is looking at a mask order, not to prevent you from catching it, but if you've got it, particularly if you're one of these asymptomatic people who are out there, but you have a sneeze or something, a physical barrier, even if it's a scarf or a jumper or whatever it might be, could stop me giving it to you if we're on the subway. So there's that.
There is. It should be said, by the way, that the CDC were until quite recently, and possibly they still are, advising doctors who didn't have masks to use a scarf or a bandana on their website. So it seemed like double stands there. I was going to say on the mask thing, it's been a bit weird, the mask, because they originally advised people not to get masks. Forget the bandanas for a second, not to even have masks. But there are countries like Austria, Slovakia, the Czech Republic, where it's compulsory to wear masks in the street at the moment. And obviously, places like Taiwan, it's as good as compulsory, even though it's not in the law, they all do. Yep. And Taiwan's done pretty well for themselves.
Well, the big problem the United States had was that because states and cities and individual hospitals were basically saying, go to the open market to try and buy masks rather than there being a strategic supply, they were competing with ordinary punters to basically buy these things. So they didn't want people on the streets to be buying them up because then the hospitals couldn't buy them up. Yeah,
and that obviously was a massive problem, the demand for masks. Although there may be a way forward on that one. Yes, because the FDA has just relaxed its restrictions on an Ohio company that has machines that sterilise protective masks worn by healthcare workers and so on. The company has 2 machines in Ohio right now that clean 80,000 masks a day each, and is sending more machines to New York, Seattle and Washington DC. So that's 400,000 clean masks a day, and they'll probably ramp it up even more from there. So that has got to help.
Brings to mind what Dr. Diane Hess told us on Wednesday night's Planet America when she was talking about there are so few masks now. They've got this sort of ad hoc system where they rotate 4 masks through brown paper bags marked 1, 2, 3, 4 in the hope that by the time they get back to bag number 1 and mask number 1, that the coronavirus will have died by itself. It's not a great system right now.
No, well, hopefully that will help. What would also help is if they sort out the testing once and for all. Certainly they had some very bad lags early when it comes to testing, and Trump's strategy for dealing with those lags was basically to blame Obama.
When CDC first looked at their test, the biggest problem they had is the test didn't work. That wasn't from us. That's been there a long time.
The faulty CDC COVID test that Trump was referring to there was obviously made 3 years after Obama, but things are genuinely looking up at the moment. As of next week, there's a company, Abbott, which will be releasing to the public a test that will deliver positive results in 5 minutes and negative results in 13. And they're going to be delivering 50,000 of those tests per day. So add 50,000 tests a day to these numbers, where America has been hovering at about 100,000 tests a day for a week. Add them together, that's a lot of tests. And I'll tell you where they need those tests, because they don't have the testing happening all over the place at the moment. It's just in some places. California and Michigan in particular, they were on those COVID-10 states before. California has had 1/15 as many tests per capita as New York. It hasn't had many tests at all. Michigan, not much better. So they look bad at the moment. They might be much worse because there's just no testing going on in California and Michigan. So they need lots of tests.
So the California miracle of acting early, social distancing, etc., it may just be They haven't bothered to test all these people.
We don't know.
Right.
We don't know. And also, the other thing, New York and New Jersey both have heaps of tests, but a huge percentage of people are coming back positive. In New York, 39% of tests are coming back positive. In New Jersey, 43% of tests are coming back positive. And even though New York is testing more than South Korea did per capita, and New Jersey is almost as much as South Korea per capita, they're still getting so many positive results, it means that they can't get enough tests. The whole place might have COVID for all we know, because they're getting heaps and heaps and heaps of positives. So now we've got some tests, we can start cooking with gas. But even better than increased regular testing is increased antibody testing. This is something that I spoke to you about last week, John. The idea being, if you can test people's antibodies in a blood test, a simple pinprick test, only takes a minute, really cheap, costs $1, and you can get everyone to do it for almost nothing, and then you can send half of America back to work safely, knowing that they're hopefully immune to the virus.
And not going to give it to other people who are more vulnerable, so you keep the over 70s at home for the time being and send the young people back out to work.
Exactly, and so that way you can get the economy rolling again without endangering the old people. That's the idea. Now, there's a company that last week tested all 8,000 residents in one Colorado town for COVID antibodies, and they're planning to roll out that process nationally. So that is exciting. Even more exciting, the first clinical studies for Johnson & Johnson's vaccine are expected to come at the latest in September for an early rollout at the start of next year, which is extremely fast for vaccine. Usually they take 5 years. Yeah. So that's really good. And that is, of course, assuming that the really, really, really fast vaccine option doesn't work.
I execute judgment on you, COVID-19.
Oh, Ramash.
I execute judgment on you, Satan, you destroyer, you killer. You get out, we break your power, you get off this nation. I demand judgment on you. I demand a vaccination to come immediately.
Yes.
It is over. And the United States of America is healed and well again.
Let me check, John. Sorry, COVID's still there.
Yes. Oh, well, still worth a try, Kenneth Copeland. Of course, the serious side to all of that is that in a number of states, including Kansas, which actually has a Democratic governor, they're allowing people to go to church on Easter Sunday. So there is still people wanting to exercise their faith in public spaces with a certain amount of social distance.
And there's been a couple of pastors who have been arrested for holding church services in states where they have stay-at-home orders.
Yeah.
So that's an interesting area.
There have been some developments as well this week we've talked quite a bit in recent weeks about the Defence Production Act and the fact that President Trump hasn't wanted to utilise this to compel industry to start producing things. The point of Defence Production Act, as in wartime, is you not only get to set the price, but you also get to tell industry what you need them to make for you. But in return, the government says, and we will buy these things from you. So you have a guarantee, you get a guaranteed price, they get a guaranteed market, which is why they turned around a week and a half ago, a few weeks too late for some, and told General Motors, we need you to start making ventilators. Well, those ventilators are going to be on the way. Maybe not as many, well, certainly not as many as they need in the short term, but in 6 to 8 weeks from now, there may be those 20 and 30,000 extra ventilators they need next week in New York City. The same with 3M now. They've just in the last 24 hours been told, start producing a whole lot more masks. Again, their production turnaround. So unfortunately, there's a real sense of there's been a wasted month or more in the issuing of these orders. But President Trump has been giving these daily briefings. 2 hours and 13 minutes was the record that was set today, the longest ever presidential briefing, although that was only 23% Donald Trump. There was also a lot of Jared Kushner, inexplicably.
He spoke.
Jared Kushner spoke. Fresh from solving the Middle East peace process, he's now heading up the Corona task force as well.
What does he sound like?
Yeah, you should have a listen. It's hard to describe. Okay. So Jared Kushner was there, raising a few eyebrows, essentially saying that the states shouldn't be making all these demands on the federal strategic reserve. Having people say, well, you know, you actually look at what the federal strategic reserve of all this equipment is. It is for the use of the states. Otherwise, It just stays in a warehouse in Washington. But still, the president has been taking a fairly sombre tone in a lot of these conferences. He's also, though, been taking regular swipes at his old adversaries in the media at these briefings, including a pretty classic exchange with CNN's Jim Acosta.
Go ahead, let's give it a shot.
Sir, what do you say to Americans who are upset with you over the way you downplayed this crisis over the last couple of months? We have it very much under control in this country. The coronavirus is very much under control in the USA. It's going to disappear. It's like a miracle. It will disappear. March 4th, we have a very small number of people in this country infected. March 10th, we're prepared. We're doing a great job with it. It will go away. Just stay calm. It will go away. What do you say to Americans who believe that you got this wrong?
And I do want them to stay calm. And we are doing a great job. If you look at those individual statements, they're all true. Stay calm. It will go away. You know it is going away, and it will go away. And we're going to have a great victory. And it's people like you and CNN that say things like that. It's why people just don't want to listen to CNN anymore. You could ask a normal question. The statements I made are, I want to keep the country calm. I don't want panic in the country.
And of course, the president is getting his regular digs in on Twitter as well.
Polls are showing tremendous disapproval of the lamestream media's coverage of the virus crisis. The fake news just hasn't figured that out yet.
And the president is right. Overall, according to Gallup, only 44% of Americans approve of the media's handling of the coronavirus crisis. Although 44% also happens to be the number that approves of the president's handling of the crisis. That, according to the Associated Press. Certainly, Joe Biden, though, doesn't approve of Trump's refusal to reopen enrolment for health insurance under the Affordable Care Act or Obamacare. He put out this ad.
At a time when Americans need health care the most, a time when our nation has to rise to the occasion, to come together to look out for each other, what does Donald Trump do? In the face of this unprecedented pandemic, this president has refused to reopen enrollment for the Affordable Care Act, preventing people who need insurance from getting it right when they might need it the most. So ask yourself, if what Donald Trump cares about during a global pandemic is a political fight, do you think he cares about you?
Okay, I'll talk about the Obamacare thing in a second, but I should say that, to be fair, that poll with the media, when the media got 44% approval, Trump did get 60% approval for handling the crisis in that particular poll. Having said that, there's polls all over the place at the moment. It seems like Trump has largely got probably a 5-point bounce overall at the moment, possibly off the back of that decision of his to close down international travel, because that's polled incredibly well. I saw a poll the other day, which I think was 96% approval of that decision. 95% were Democrats and 97% were Republicans. So everyone loved that decision. He's getting as much value out of it as he possibly can in his press conferences. But we shouldn't get carried away with that 5-point bounce, because as you said on the Wednesday show, there is a rally around the flag effect in these circumstances. Andrew Cuomo's got a 71% approval at the moment. And he wasn't a popular guy before this.
Which is why he didn't run for president, ironically enough, because he was in the 40s.
Yeah, exactly. And if you look at the other world leaders at the moment, it's quite interesting. This is Trump's polling bounce here at the end of this graph. This is Boris Johnson's bounce. And this is Macron's bounce. And this is Justin Trudeau's bounce. And this is Scott Morrison's bounce. And I wouldn't say that all those leaders are exactly kicking goals right now, John.
So President Trump has managed to flatten at least one curve.
Yes. But just on the Obamacare thing, quickly, I should explain what that ad was referring to. With Obamacare, there is only one time per year that you're supposed to be able to enroll for these subsidised healthcare plans. And if you lose your job, say, you can then enrol after that if you need health insurance, but it's really tricky and there's a lot of dodgy paperwork, and so a lot of people don't. Now, if you open the enrolment period, like Biden is saying they should, it becomes easy for them to enrol. And he's saying they should do it now because a lot of people have lost their jobs. You mentioned it this week. Look at this graph. This is the initial unemployment claims over the last few decades. And We heard last week it was 3.3 million. This week it's twice that, 6.6 million. It's quite a big bump in that graph. You can see it, John. So that's a lot of unemployed people. Not all of them will have insurance. In fact, a lot of them won't because they're retail workers who often don't have health insurance. But those who do will find it very hard to get health insurance right now. And right now, if you have pneumonia, say, forget COVID, because COVID is being funded by the government, the treatment. If you get pneumonia or something like that, $10,000 if you don't have insurance. Sometimes $20,000.
Right.
So it's important. That's
Sure
what that's
is.
about.
All right then. Well, let's turn our attention now purely to the 2020 presidential campaign, because earlier today the Democratic Party announced its mid-July convention has officially been postponed by a month. Now, that's not unusually late. The Democrats had moved it up to avoid clashing with the Olympics, which, of course, is now no longer a problem. 15 states have already delayed their primaries because of the coronavirus pandemic, but so far, not the state of Wisconsin, which is due to vote next Tuesday. In ordinary times, that would be the biggest political news of the week, potentially the last roll of the dice for Bernie Sanders. The Vermont senator won Wisconsin against Hillary Clinton in 2016, and as the nominee, Hillary then lost Wisconsin in the general election to Donald Trump by fewer than 23,000 votes. So if this November's general election is close, Wisconsin could very well be the tipping point. It could be the decider, and that is why the Democratic convention is being held there. Now, head-to-head polls put both Joe Biden and Bernie Sanders narrowly ahead of President Trump right now. But while that may give Bernie supporters some heart, the head-to-head polls with Joe Biden, probably not so much. In Wisconsin, Sanders is currently trailing by an average of 18 points. That is bad news for Bernie in a state he won last time, and he needs some very big wins from now on in the process if he's to have any chance of overtaking Biden amongst the delegates. Of course, after Biden's weak start in the primaries, his comeback in March, it was historic. He opened up a 300-plus delegate lead over Bernie, who was looking almost unstoppable as recently as late February. The wild card, of course, though, is the coronavirus. Wisconsin's Democratic governor this week, Tony Evers, he says he wants that primary to go ahead next week, despite the shutdown of the state and most polling places. There is more on the ballot than the Biden-Sanders primary. It's also the election for the mayor of Milwaukee, a bunch of local and state officials, including the Supreme Court justices. Lawsuits are flying this week. Voters are being told you have to apply for absentee ballots, but state officials are refusing to send them out to everyone so that everybody can vote by mail. You have to ask for them. Meanwhile, there are no campaign events at all being conducted, but of course there are the ubiquitous TV commercials, like this one from Joe Biden.
I've talked about the soul of this nation. We're seeing it. We're seeing it on display in this crisis. Courage, bravery, a belief that we're all part of something bigger than ourselves. This crisis isn't going to defeat America. Not today, tomorrow, or ever. This is the United States of America, and there's nothing we can't do if we do it together. The American people have never, ever, ever, ever let their country down. We just got to give them all they need now.
Joe Biden with an ad filmed in his living room in Wilmington, Delaware. The voters are also seeing ads like this one from Bernie.
Now, our country is at a turning point. A dangerous demagogue tearing our nation apart. Hard-working people betrayed by Trump. A healthcare system that makes enormous profits for drug and insurance companies. And a planet on the brink of a climate disaster. In this moment, we need a fighter. Bernie Sanders. We know he'll fight for us as president because he always has.
I'm Bernie Sanders, and I approve this message.
So both of them very much punching up at Donald Trump rather than at each other right now, such as the weird sort of nature of this primary. Bernie's best hope, of course, in Wisconsin is that with a lower turnout because of COVID-19, that primary will look a bit more like a caucus where he tends to do better because of his younger, highly motivated supporters. They may actually turn out to vote. And we can't discount the fact that for Biden's base, which is typically over 65, there is a greater physical risk right now, of course, in going out into public. And maybe they've had other things on their mind than sending away for postal absentee votes right now. So this is a difficult situation.
That is absolutely true that there's a big threat on Biden's base. And not to mention the fact that young people can get out there to campaign as well a bit more as well.
Yeah, exactly. Although there's not a lot of door knocking going on, but yeah, you can still wave placards if you're distant on a median strip. Meanwhile, Bernie Sanders was on the Seth Meyers show this week, and he was asked, are you still in this to win? And he said, yeah, look, there is a narrow path to the nomination, very narrow, with 300 delegate deficit. But he also kind of intimated that this is about more than him winning the presidency. It's about him shaping the politics of America this year. Take a look.
To make the world know that we need Medicare for all, that we need to raise the minimum wage to a living wage, that we need paid family and medical leave, one of the crises that we're dealing with right now, that we must address climate change and education, all the issues that we have been talking about. Campaigns are an important way to maintain that fight and raise public consciousness on those issues. So that's, I think, one of the arguments for going forward.
Now, of course, for some Democrats, this is looking like a bad rerun of 2016. Bernie can't win, but he stays in and damages the eventual nominee, handing victory to Donald Trump. The other wild card, of course, Chaz, is Joe Biden himself. We're expecting him to collapse last year. He didn't. Then, of course, in January and February, he did collapse. Then he came back. But as you reported on Wednesday night's Planet America, there are now these very serious allegations of sexual assault from a former Biden staffer that it's not getting a lot of coverage, but it could become a real issue for him.
Yeah, it's not being covered by the mainstream media a lot at the moment, but certainly Sanders supporters are trying to draw people's attention to it, not only for their own partisan purposes, but if you're not desperate for Joe Biden to win and you're a Democrat, you're probably not a big fan of your nominee being accused of sexual assault.
Yeah.
It's so yeah, whether they pan out, you know, to have more evidence or something, we don't know yet. But you're right, it is a real wild card. I'll tell you another wild card in this actually is money. You mentioned the ads, how at the moment they can only campaign on the airwaves. Joe Biden has no money. He had no money before his huge burst, and just when he was starting to raise money, that's when COVID hit. So he couldn't go dialing for dollars, and he needs to only raise it through the internet, which he's never raised much money from. And in particular, if he does win the nomination, which let's assume for now he does, he's got a real problem against Trump, because now is the time when these people usually earn all their money.
Right.
And if you have a look, between the president's re-election campaign and the Republican National Committee, he began March, Trump, with a combined $225 million in cash on hand, whereas the Democrats and Joe Biden combined started with $20 million on hand after accounting for debts. So if Joe Biden spends what little he has against Bernie Sanders now, he's going to have zero against Trump afterwards.
Right, yeah. Well, I guess the only upside to that for Joe Biden is he's not earning money now because online donorship has dried up quite significantly, as you'd understand, with an economic crisis. He's not spending much in that living room in Wilmington, Delaware either. Well, the big question now, of course, is do diehard supporters of Bernie Sanders still think that he has a shot of being the President of the United States or the Democratic nominee? And if not, what is he trying to achieve right now? To answer some of those questions, I spoke to Ben Jealous, who is the former head of the NAACP, the big civil rights group in the States. He endorsed both of Bernie's presidential campaigns. Bernie, in turn, endorsed Ben Jealous when he ran for governor of Maryland a couple of years ago, which he lost by double digits to the hugely popular Republican incumbent Larry Hogan. Take a look. Ben, with Bernie Sanders 300 delegates behind, a lot of pressure on him to drop out of this presidential primary. Should Bernie get out of the race now?
This is exactly the time that Bernie Sanders should lean in. His policies are extremely popular, and these tough times, this COVID crisis, is showing the need for them. And so it's important for Bernie to stay the course. It's important for voters in every state to have the chance to vote. And it's critical, even if Bernie doesn't win, and he's 300 behind, and while that's a slim margin, he may not be able to make it up. But his staying in will help ensure that his voters turn out this fall. His campaign's not a cult of personality. His campaign is really a coalition built around several core policies. Joe Biden has yet to embrace any of them. And it's critical for Bernie to keep the pressure up so that the Democrats have the biggest possible turnout this fall.
at the final, there may be another debate, but at what is currently the final debate that was held, Joe Biden did try and win over some progressive voters by talking about free college tuition and reviewing bankruptcy laws to win over some Warren supporters. That's a start, but what else do you think he needs to do to win over those younger progressive voters?
What this is going to come down to is Joe Biden's going to need to either embrace the Green New Deal or Medicare for all. Now, I would have told you, say, 4 weeks ago that there was no way that Joe Biden would ever embrace Medicare for all. But given how weak this COVID crisis has shown our healthcare system to be, I think both of those are still in play. And it will largely depend on what happens over the next few weeks. And that includes the Biden camp really digging in to understand why young people have not been voting for him. I mean, to lose an entire generation, like 85-15, is startling, especially when they're the future of our party and our country, and you simply cannot become president without them when the race will be tight.
Ben, what do you say to supporters of Joe Biden and indeed of the sort of Clinton moderate wing of the party? You say, hang on, Bernie lost in 2016. He's losing now. He doesn't get to tell us what we stand for. If his policies had so much appeal, he'd be the nominee. Well, he's not.
Well, you know what, look, I think, first of all, we just got to be clear that every member of the moderate wing who was in this primary because they were concerned that Joe Biden could not make it to the. They need to be honest about that, and therefore give Bernie some grace if he still has the same concern, that Joe Biden simply could fall apart as a candidate before this is all over. The next thing that we have to just frankly realize is that this race will be very, very close. It will be decided once again by swing voters and unlikely voters in a handful of states. And there's simply no way for the old Obama coalition to win without young people. And those young people, frankly, support Bernie because of his ideas. And so Joe is going to have to stretch. This is a time when candidates, quite frankly, if they want to, it's on him. If he's in the lead to pull this party together. And the only way he can do it is by reaching out to younger people and embracing their ideas.
We've heard plenty of criticisms of Joe Biden in recent times. He's too old, he's lost a step, he's too moderate to excite the base. In the last week or so, we've also had a resurgence of claims that he may be a sexual predator. There are allegations from a former staffer, Tara Reid, that Joe Biden sexually assaulted her in the 1990s. How should that be dealt with at this point in the campaign?
Quite frankly, U.S. mainstream media needs to do what you're doing and actually ask the question. And they need to ask the question of Joe Biden. Now, these are serious concerns. She is a very credible accuser, and he needs to answer for it. He needs to be asked about it. We need to hear from him on the record. I think his campaign seems to be hoping that they can sweep it under the rug. That's not going to happen. It's important that Joe come out and, frankly, speak clearly to the people about what happened in this instance. And we saw Bill Clinton years ago try to not talk about similar issues. He had to come out and deal with them. Joe's going to have to do that too.
At the moment, a lot of the allegations are being promoted by supporters of Bernie Sanders. This can appear as though it's pretty base politics, that this is about smearing Joe Biden as a kind of 11th hour attempt of swaying this nomination to Bernie Sanders. Is there danger in that for Senator Sanders?
I'm not a surrogate for Bernie, and his campaign, I don't know that they've taken on this issue. It's clearly there are a lot of voters concerned. There are even moderate candidates for Congress and for different offices who have begun to talk about it. There's simply no way for Joe Biden to say, oh, this is about Bernie's campaign or this is about somebody else other than him. He's going to have to deal with it. Anybody who's run for office knows that there comes a time in your campaign when there's simply an issue that is your issue that's so big that you have to deal with it. This is Joe Biden's issue, and he's going to have to deal with it.
There are some pretty unprecedented restrictions now on people going out in public. There are some states that have got their mail voting systems up and running, but there are big questions as to how the rest of this primary is going to be conducted, much less how the Democratic Convention in July is going to be conducted. Maybe that's going to be done remotely as well. Given that, realistically, what can Bernie Sanders hope to achieve if he suddenly starts winning primaries that he was going to lose by 30 points according to polls because of a big online organising campaign? He's going to have real legitimacy problems, isn't he?
The simple fact is that dozens of states have not voted yet, and the voters in all of them, as citizens of this country, are entitled to have their voices heard. You've got to remember that Joe Biden was counted out before Super Tuesday, and certainly before the South Carolina primary. He had embarrassed himself in Iowa and in New Hampshire and in Nevada, and then he came roaring back. And so this has been one heck of a roller coaster ride, and you've got to sort of be patient with people who believe that the last curve in the roller coaster may not have been seen yet. Now, there are still hundreds and hundreds and hundreds and hundreds of delegates up for grabs. There is a massive health crisis that really, frankly, speaks to the need for us to have health care for all in this country. And there's an absolute need for the party to be prepared to come together this fall. If you were to see Bernie Sanders fold right now, you would see a lot of young people walk away from this party. It's not that just that they feel like he's been disrespected, they feel like they've been disrespected. And when you saw moderates start to call for canceling primaries, frankly, that plays right into the hands of Donald Trump, who, if we see a second spike in COVID come this fall, could be suggesting that we try to put off the national election. Now, he has no constitutional way to do that, but that's never stopped him from trying to build a movement for a crazy idea that's dangerous to our country. So we, as a Democratic Party, have to embrace democracy. We need to make sure that everybody's voice is heard, and we've got to listen to every generation. And that means that Joe Biden, who's almost universally lost young people so far, needs to listen to young people and to embrace at least one of the big ideas that is so central to why they're voting and what they're voting for.
Well, Ben Jealous, we certainly appreciate you taking the time under what are difficult circumstances, I know, for all concerned. Thank you so much.
Thank you very much. It's been a real joy to be with you.
Now, at the beginning of the show, I pointed to China's supposed 35 new cases of COVID-19 today. And
so cynical.
I know, I've been expressing a few doubts about those Chinese figures for some time now. And part of the reason that people do trust them is because this guy vouched for them. One of the leaders of the World Health Organization, Dr. Bruce Aylward. He's been very positive about China. He says he didn't see anything that suggested manipulation of numbers when he visited China. But people are starting to get a little bit suspicious about that guy. This week, a clip came out of a Hong Kong reporter wanting to ask him about Taiwan being admitted to the WHO, something that China very much doesn't want. And this is how he reacted.
Will the WHO consider Taiwan's membership? Hello?
I'm sorry, I can't hear. I couldn't hear your question.
Okay, yeah. Let me repeat the question.
No, that's okay. Let's move to another one then.
Right, because I'm actually curious on talking about Taiwan as well, on Taiwan's case.
Okay, so not exactly subtle there. There's a few people at the moment questioning exactly what's going on with that guy. But let's just think about this for a second. If China really only had 35 new cases in its entire country yesterday, then why did it totally lock down Henan province? Not to mention, it also shut down a bunch of activities in Shanghai and Sichuan province as well. All that for 35 cases across the whole country? Well, American intelligence doubts it. They supposedly have a classified report that says China is systematically underreporting both total cases and deaths that it has suffered. And while I'm not normally super trustworthy about US intelligence either, or anonymously sourced newspaper articles, China itself has admitted this week that it has more than 1,500 people who were infected with the virus but haven't shown symptoms that were not included in their stats. That's not overall, that's just right now. And they said that they would start to report infected people without symptoms beginning Wednesday, whereas other countries have been doing that the whole time. We're talking about 25% of cases there that China is completely not reporting until now. But why does this matter? Well, firstly, countries like America are trying to learn from China's experience to plan what they're going to do. And if China's been lying, that stuffs everyone up. Secondly, if the World Health Organization is sucking up to China at Taiwan's expense, that means back in December, when Taiwan warned the WHO that coronavirus could be passed via human-to-human contact, China denied it. And so Taiwan's warnings were not shared with the rest of the world by WHO. That cost the world a month. And how many tens of thousands of deaths? We don't know. And by the way, one more little thing. Those wet markets that China had where they sold all the animals all stacked up together, that's where people think this thing started. Well, China's just reopened those markets and they're selling bats again, the animal that coronavirus may well have come from. Now, we're not 100% sure about that, by the way, but nevertheless, I thought it might be worth mentioning.
Yeah, I heard the armadillos were involved in some way as well. But that is all for this week's Fireside Chat. Thank you for tuning in on ABC News and News Radio. We're taking a couple of Fridays off the air over the Easter break, but only for the Friday show. We will have an all-new Planet America on Wednesday night at the all-new time of 9:30 p.m. on ABC TV.
And of course, you'll find more on Facebook, YouTube and iView, including bonus interviews and the podcast extra that I make with Dr. David Smith. We talk about all the things we don't talk about on this show. You should listen to it and watch it. It's on all the usual podcast platforms.
Now, during this epidemic, Chaz, we have seen a lot of things to make us very concerned, very worried, like Tiger King, for instance.
Oh, no.
And a few things as well out there to give us a sense of hope and positivity, like those Italians singing from their balconies. Well, in New York City this week, at 7 p.m. each night, they have been stopping, getting out on their balconies and applauding medical and care workers. We'll leave you with the sound of New Yorkers' gratitude. Good night.